This week on the agenda, tackling obesity. With more than 1 billion people now seriously overweight, what can be done to solve the world's biggest health problem? Obesity is a chronic health condition that occurs when you're very overweight. Anyone with a body mass index of more than 30 is considered obese. More than 1 billion people globally are now living with obesity. That's 1 person in 8. And by 2035, more than half of the world's population is predicted to be obese. It's a universal medical problem associated with mental health issues and increased risk of many other conditions, including heart disease, diabetes, and certain cancers. The global cost of treating obesity-related diseases is around $2 trillion a year, equivalent to 2.8% of the world's GDP, putting huge pressure on healthcare systems worldwide. There's no definitive cure for obesity, but weight loss drugs are being presented as a potential solution. That market is expected to be worth $80 billion by 2030, as demand for such drugs is set to grow at unprecedented pace. So how big is the health and economic challenge of obesity? And how can societies, the food industry, health systems and individuals respond better? Joining me now is Dr. Julianne Williams, Technical Officer for Non-Communicable Diseases at the World Health Organization Europe. Thanks ever so much for coming on the agenda. Now, obesity isn't only about diet and exercise, is it? How would you describe it?
Yeah, thank you very much. We think of obesity as a really complex disease, and indeed, it's influenced by both individual factors, so your genetics, your biology, your own behavior, but also really by the structural factors where we as individuals interact. So when we're looking at causes of obesity, we often focus on food environments and physical activity environments, because those are the things that have changed since obesity started rising since the 1970s. Sometimes we want to say, oh, it's our biology, it's our genetics, and there is a component of that. Yeah. But really what has changed and been associated with the obesity epidemic is our changing environments. And that's largely the food environments and our lifestyle. It's very difficult for many of us to be active, so our sedentary ways of living.
What if the world doesn't get a handle on obesity? What are the consequences? What are the risks here?
Well, you could look at it from so many perspectives. So for individuals, for families, it affects quality of life, it affects health. We know that obesity and non-communicable diseases, they often affect people in some of their most productive years. So there's economic effects. And for countries, of course, it's a really, really pressing issue because of the strain it puts on healthcare systems, but also what it does when you have a workforce that is unable to contribute due to these diseases. So we are seeing from the latest data actually that maybe some countries are finally starting to halt the rise in obesity. The voluntary target that WHO has set for countries is to halt the rise. So if you look at a 2010 baseline level of obesity in countries, the goal that we have is just to keep it at that 2010 level. And only until recently have we seen just 1 or 2 countries actually meeting that. But that's a really exciting point for us, because for so long we've just seen in every single country it's going up, up, up. And finally, we might be seeing some countries successfully halting the rise, and then hopefully eventually being able to achieve some of those sustainable development goals about disease and preventing early death from those non-communicable diseases.
You've mentioned a couple of individual cases, but the broader picture is that obesity rates are growing. But at the same time, so too is the number of people going hungry. how do we go about striking that balance between addressing those two issues?
It's a really important issue, and indeed, with some of the economic circumstances, we have seen an increase in food insecurity. One of the ways that it manifests itself is something that we call the double burden, or even the triple burden of malnutrition. And so that's where you see this coexistence. It's kind of a paradox, but you'll see people who are living with overweight and obesity alongside maybe they have micronutrient deficiencies. And that can be within the same individual, or it can be a household. Maybe some people in the household are overweight and obese, but they also have household members who are underweight. And then you can see it in countries. So especially in some of the in our region, in the countries farther to the east, you'll see that in population. So you'll still see relatively high levels of stunting and wasting, so a deficit of calories alongside a growing problem of overweight and obesity. And that's really scary, because for health systems and learning how to respond to both of those things at the same time, it can be doubly challenging.
I mean, some might say, look, poverty and hunger, that food insecurity that you've zoned in on, is very different to obesity, which is perhaps people bringing it on themselves, consuming too much of the wrong kinds of foods. So how much of a problem is that in tackling obesity?
Historically, the position in public health was to say, yes, it's the individual. That lazy individual is making bad decisions. They're choosing unhealthy foods. They're not exercising. And I think increasingly there's recognition of kind of the larger socioeconomic determinants of obesity, and the fact that it's a societal problem, it's a national problem, it's an international problem that requires governments to kind of take responsibility for the situation, alongside with equipping those individuals to make healthy choices. I think one of the other kind of paradoxes which has emerged over the last couple decades is that so much of the food that makes us sick, that contributes to overweight and obesity, because it's highly palatable, it's really high in calories, it's pretty low on micronutrients, so there isn't much that's good for us in it, and we have a hard time stopping the consumption of these foods. These are the foods that have proliferated the environment. So, and then to make matters worse, those are the foods that are often marketed. We know that these companies often target children and vulnerable groups. And then our biology, which developed to live in an environment of scarcity. If we think about our hunter-gatherer ancestors who had to live in the jungle and fight for every calorie they could get, that's kind of a mismatch with our new environment where there's this excess of calories. So not only is there good, cheap, tasty food that makes us sick, our biology is also kind of pushing us toward consuming that food.
Dr. Julianne Williams, thank you very much.
Thank you.
As the Chinese economy has grown, so too has its obesity problem. Recent figures suggest more than 10% of children under 6 there are seriously overweight or obese, and that rises to almost 1/5 of under 17s. In July, new guidelines were released to tackle the problem. To discuss that and more, I'm joined now by Mann, a professor of epidemiology at the Huazhong University of Science and Technology. Thanks for coming on the agenda. Look, what is the scale of the obesity problem in China? But do we know why and how it's become such an issue, particularly amongst children? I mean, reports suggesting, as you're talking about here, that 40% of Chinese children will face obesity by 2030.
Oh, yes. For obesity, certainly there are many reasons and determinants and risk factors for obesity. And we published Latent Obesity in China series 3 years ago. And we classified the determinants of obesity in China into 3 categories, particularly the systematic forces, the environmental drivers, and also, of course, the individual factors. And many of those risk factors related to obesity are very, very common in China as well as to many other populations. But there are some specific factors that are affecting the Chinese people more. And so, for example, in the Chinese traditional culture, obesity was not viewed as a disease, but as a health and wealth. And large body size and large body weight in children are often misinterpreted as healthy growth by many caregivers, particularly the grandparents who are taking care of the children. And also, secondly, many adults in China, they experienced malnutrition in their early life. But right now, with the abundant food environment nowadays, the scientific evidence has suggested that this kind of combination really promotes weight gain. And in addition, we know that the food environment and building environment in China right now has changed so dramatically in the past several decades.
But I want to talk to you about this research from Fudan University that found a gene that appears to protect people in certain regions in South China and Southeast Asia from obesity. I mean, despite that genetic advantage, China has some of the biggest obesity numbers in the world. So what's going on?
The proportion of people carrying this gene certainly is not high. And more people are actually carrying risk alleles. And in addition, all the current evidence, from many genetic studies have demonstrated that the variation in body weight explained by gene is actually relatively low.
So let's talk about tackling the obesity epidemic. At the recent 2024 China Obesity Congress that was held in Beijing, the emphasis really seemed to be on encouraging healthy lifestyle changes rather than relying on medication or surgical interventions. What is China doing in that regard?
Lifestyle modification is the foundation for weight management in all the guidelines in China and also around the world. Therefore, we should encourage healthy lifestyle changes as the first choice for weight management. And China has issued the Healthy China Initiative, and the healthy lifestyle promotion is actually a core for this national program.
Something I think is quite interesting is that many hospitals in China have outpatient departments for weight control. And I wonder if you think that other countries might be able to take from China's approach to managing obesity.
Yeah, I do think that many other countries, including China, need to move towards this. Is that obesity should be treated as a chronic disease, and it needs multi-sector to work together to prevent obesity and also to help people with obesity for their weight management. And so we need to really work together.
In terms of managing that weight loss, I note that those weight loss drugs, Wegovy and Ozempic, are approved for use in China. It is a huge market. There is a pipeline too, though, a strong pipeline of rivals, local rivals, in those final stages of clinical trials. How important do you think the weight loss drugs market is in China, and where do you see it going?
Well, as you mentioned, this is really a huge market, and indeed we have more and more encouraging news from the scientific research that more and more effective weight control drugs are being now on the market, and this is really a good thing. I do see more and more people with overweight obesity, they are using these drugs in China to help them control their body weight. But as I mentioned, those drugs still need to be paid by themselves, and so there's a need to promote these drugs into the insurance system to reduce the burden for the patients. And on the other hand, we still need to emphasize the importance of prevention of obesity for the general public. Because if prevention is not successful, we still will see more and more people with obesity that need to be treated by the drug. And this will not be sustainable for the society, I think.
Professor An Pan, thank you very much.
Thank you. Thank you for including me.
Still to come here on the agenda, we look at the role of the food industry in the obesity epidemic.
We are all connected. Across borders, across continents, connected by ideas, a shared humanity. Stay connected.
Welcome back to The Agenda. We've heard about the scale of obesity as a global health issue, but what role is the food industry playing? Joining me now is Simon Wright, a food broadcaster and educator. Simon, thanks for coming on The Agenda. Now, obesity levels around the world are rising. Who is making us fat?
It's a mixture of factors, but I think the main thing that we have to look at is the industrialization of the food system and the way that people are eating as a consequence. As we've moved away from eating food made from raw materials, from what we might call real food, natural food, we've moved into a world where food is increasingly processed. It contains lots of things that aren't there actually for nutritional reasons. And so we've had this huge shift in our diets, this huge shift, I think, at the same time in our relationship with food. And I think that's what's really key to it, is the breakdown of that relationship with food as part of our lives. So it's very culturally complex in that respect. But of course, it's largely the result of the power and intensification of power of the food industry, of a few big corporations. Their marketing power and their ability to control the market in lots of different ways, including the availability of fresh food to ordinary people around the world.
So if a key part of obesity is because we eat too much, we overeat, or we eat too much of the wrong kinds of food, you're talking there the key role of the food industry in maybe, dare I say it, manipulating that?
Yeah, I mean, look, you know, these are only companies acting as companies do for the benefit of their shareholders. They show certain elements of corporate responsibility from time to time, but that's within a very narrowly confined parameters. And look, the reality of this is that what we're seeing is the conflict between what we need for a healthy population and then health services that can cope with the health of that population is different from what people are eating at the moment and being encouraged to eat. Now, you know, there are a number of ways of combating that and restricting the power of corporations, but you know, it's my belief also that a lot of this is about positive messages around fresh food, around cooking, around cultural relations with food, and re-establishing the connection that we've historically always had.
In terms of establishing or re-establishing that connection with food that we've always had, does that make business sense? Aren't we seeing pushback from the food industry?
Well, we are, and you know, the global food system is very complicated. It's never, you know, in one respect, you can say we've never fed as many people for as cheaply as we do now. So you can see why, you know, the reasons that it's come to dominate in the way that it has. But it's not my belief that we can really expect those corporations to make the moves that we need. Governments do have to be involved in that. But I also think that a key part of this is getting communities to understand that to regather themselves around food, to reinstitute the practice of cooking from fresh, to enjoy meals together, to give time to food. It's a crucial part of our lives in so many ways. It's not just physical health, it's mental health too. And the way that we treat food with the lack of respect that we do, and for the lack of respect for the way in which it's produced, because this is not just about health, it's about the environmental impact of the food system too. You know, we really have to start giving food the priority and respect that is needed if it's going to be at the center of our lives, and we're going to live healthily.
So how do you do that? Where do you start? I'm thinking maybe of schools where so much of it is to provide those meals to children as cheaply as possible, and that's going to have a knock-on effect on the nutritional value.
You know, that's extraordinary in itself. Why would we want to do that? Why would we not see that investment in children's food as a massive investment in the future? What could possibly be more important than the food that children eat on a daily basis from the public plate? And, you know, let's be honest, it's government that's controlling that. And I think schools are the great opportunity to break this cycle. And the work that I'm involved in involves taking chefs and cooks from independent hospitality or your favorite cafes, restaurants, etc., getting them into the community to teach cooking skills, but also to improve food literacy through that method of cooking. And it's a tried and tested method, and we see extraordinary results in a matter of weeks. But that's the culture that needs to change. Again, it seems to me incredible that we can go into schools and find the lack of quality on the plate that we do, when that is going to determine the health outcomes of those children now for decades to come.
Of course, we're talking about food in schools in the United Kingdom in particular, and I know it's different from place to place, from country to country, from region to region. But I wonder how efforts around the world to curb childhood obesity might have been thwarted, perhaps, by the food industry, by government decisions.
I think the thing is, if you take the food industry on head on, its marketing power is such that it's always going to win that battle. The way that it has to be approached is to say that's a version of food over which people have very little sovereignty over. Here's another version of food over here. This is the one that we make from fresh. This is the one that brings you the thrill of great creativity. This is the one you can actually grow yourself. And what we find with young people is that when they gain that sovereignty over what they're eating, it changes their whole attitude to food. So I think school intervention, and I mean really early years intervention, is essential to counter that power of the corporate food industry.
Now, China unveiled a comprehensive 3-year campaign in August to address the growing problem of obesity and of overweight individuals. And I wonder if you've had a look at that, if you think it goes far enough, and if it's the kind of approach you'd like to see other countries taking on too.
I think one of the problems that we have to recognize is that governments spend millions across the world trying to tell people how to eat. And actually, there's very little evidence that any of that money that's spent makes any difference. Just telling people what to do because it's good for their health, because it might be good for the planet. When you're struggling to feed your family, that can sound very, very irrelevant. It's about access to fresh food in many cases as well, too. So, I welcome any efforts to try and change this picture, but as I say, it has to be focused on establishing a different relationship with food, the proper human relationship with food, which is one based on the way we've evolved, which is one based on nature and the things that we need to put in our body if we're going to lead healthy lives.
You say you welcome efforts being introduced to change the focus. So where? Which countries? Where are we seeing and that growing realization that the food industry needs to change and that the attitude towards food needs to change?
Well, I think we are seeing that growing realization, but it's not always with governments, or it's with parts of government or regions of government where there's an understanding that the method you need to apply is one of skills and reestablishing that relationship with food. I think a lot of that work is being done by communities and civil society across the world. It's certainly what we're involved in. You know, government often doesn't act as quickly and as nimbly as it needs to do. And in our instance, what we're trying to do is to say, well, look, we're going to do these things anyway. And we hope that government will fall in behind us. So I think that's where the great hope comes from. It comes from communities in all parts of the world that are taking it into their own hands to change things, particularly in schools.
Tell us a little bit about some of the community projects that you've been involved in.
So in just one county in Wales where we've operated this year, in Carmarthenshire, the new charity we're establishing, Ceg yn y Bowld, has actually trained around 500 kids since Christmas on 6-week courses. And what we see is quite transformational. I mean, it's kind of beyond our expectations, really, which is that, if you do it in this way, giving a positive message, letting kids actually do the cooking and you enthuse them, then we see change in that 6-week period that we just wouldn't expect in terms of what the kids are willing to eat, and in terms, in particular, of their ability and enthusiasm to cook, because they go home and do this too, and they demand it of their parents.
And what about in more remote places around the world? It might not be as straightforward implementing that kind of program.
It's never straightforward anywhere, but of course what we find in communities, we're taking professional cooks and chefs in there, but the skills are already there amongst the community as well, because they go through generations. So if you take some of the small post-industrial villages that we're working in, not the wealthiest of places, but you find there's a huge treasure of older relatives, in particular aunts and grandmothers and uncles, who've got skills in cooking and growing, which they're really eager to share. So I think that's a worldwide thing. It's going to be different everywhere, but it's very much about reconnecting with our indigenous food cultures as well.
What impact do you think that the new weight loss drugs are going to have on fast food, on processed food, on that whole market?
Well, I think that the jury is very much still out on the long-term effects of those drugs. Look, we can see that there are short-term benefits in some respects, but we have to remember that our diet it's not just about avoiding being overweight. It's about all the other nutrients and minerals and micronutrients that we need in order for our bodies to be healthy. And, taking drugs to reduce the appetite is not addressing those problems. So, to me, it's a sort of sticking plaster approach. I really don't want us to see us ending up in a situation where almost the same corporations are selling us food on the one hand that's making us ill, and then are benefiting from selling us the antidotes to that on the other hand. So I'm skeptical about the long-term efficacy, but I understand that it can bring, much needed to relief people in acute situations at the moment.
I want to pick up on something you said earlier about how it's just business in terms of food systems and the food industry and their marketing campaigns. It suits them to push some of the foods which might not have that nutritional benefit, which might be having an impact on how much we eat and the kind of food we eat. Do you think, though, that the food giants who are potentially making us fat are also profiteering from the slimming industry?
Well, look, there is that sort of, you've got that kind of picture that corporations that are selling you food are also involved with corporations that are selling you the antidotes about food. There's money to be made from this. And as I say, if we are constantly going to just deal with the symptoms and not the causes, then we're really not going to improve the situation. I think there's I don't want to sound too romantic about this, but there is a better food world out there for all of us. And it's not just about health, it's about the way that we enjoy life, the way that we socialize around food, the priority, as I said, that we give it in our lives. And I think that's where the big battle is to be fought. Now, I would say that I've been involved in food all my life. I have a particular love and affection for it, but I'll be honest, I think that's shared by the world.
Simon Wright, thank you very much.
Thank you.
You can watch every episode of The Agenda in full on CGTN Europe's YouTube channel. And for exclusive extra content from me, my guests and the rest of the team, don't forget to check out The Agenda Show on TikTok. Coming up on a future agenda, what next for the nuclear industry? We'll be coming to you from the World Nuclear Association's annual symposium. But for now, from me, Juliet Mann, and from all the Agenda team here in London, goodbye.